in the intense world of medical emergencies,
One patient, 3 times stab wounds.
there's nothing more extreme than a code red.
This is a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
Got 1 male still trapped in the vehicle.
In the West Midlands, a highly specialist team are on call 24/7, ready to race to these major traumas.
ETA 4 minutes.
By road and air,
03, we are lifted from Cosford.
responding to the most severe 999 calls,
Open up the Lucas device over there for me.
day and night.
All right, well done.
From car crashes
Yeah, just need to check.
to stabbings.
We're going to put some oxygen on your pal.
Here, where time is critical, lives will be saved. On roadsides, in back gardens, and inside homes.
Okay, coming off the chest.
These emergency doctors and paramedics use cutting-edge trauma techniques and surgery normally only seen in operating theatres to save people from almost certain death.
Sorry, mate.
I know, mate. I know. We're going to sort you out.
Filmed over 2 months with the critical care team,
Ready, set, slide.
we captured every vital second as these specialist crews work to save lives.
On roll. Ready, steady, roll.
Tonight, a man collapses in a Wolverhampton churchyard.
Stand clear. 3, 2, 1. Back on the chest, guys.
A police pursuit ends in a major RTC.
He's been ejected from the rear in a car crash.
A pensioner falls down a flight of stairs.
Joe, is it hurting anywhere? I'm pushing here. Yes, whereabouts?
In your neck.
And a motorcycle crash
That's it, Cameron.
leaves a teenager in agony.
There's lots of things, elements to our job. Save lives, wash cars.
Critical care paramedic Fay Pollock is beginning her first 12-hour shift of the week. It's essential that the emergency car, which is charity funded by Midlands Air Ambulance, is kept in tip-top condition.
The public have paid for it, so actually it deserves to be well looked after and clean and presentable, really. We are a professional body, so therefore we have to have professional vehicles. And it takes 10 minutes to wash a car. But it's freezing, it's so cold. Oh my God, I can't feel my fingers.
Ambulance service. Is the patient breathing and conscious?
Yeah, he's been knocked out. Just a motorbike and car collision.
So it's a car v motorbike. Okay. Can you see any obvious heavy blood loss?
No, I think he might have broke his leg.
I just need to try and rule out any life-threatening shock, okay? Does it look very pale or grey to you?
Yeah, we got enough gates on the stomach.
All right. The help's already been arranged. When on blue lights and sirens, okay?
An ambulance has been dispatched, but critical care paramedic Fay is also urgently needed.
There's an ambulance crew in attendance with him. They say that he has got, thank you, sir, a broken leg. He's in quite a bit of pain. They've maxed out on the amount of analgesic drugs that they can give him. So they have requested me to go and give some enhanced care. But if the impact was enough to break his leg, then there might be some underlying injuries that we haven't yet identified, so.
More than 300 motorcyclists are killed and over 5,500 seriously injured every year on Britain's roads.
Ah, yes, I see blue lights.
Fay arrives 17 minutes after receiving the call.
Hello, how you doing? Oh, he's a motorcyclist versus a car, yeah. Cameron, you say? Cameron, listen, my name's Fay, I'm with the Midlands Air Ambulance, OK?
On his way to work, 18-year-old Cameron's motorbike collided with a car. He was thrown off the bike, landing 15 feet away on the grass verge.
This is where you landed?
You landed where I landed. I flew straight over the bunny.
OK.
The ambulance crew has already reported that Cameron has a broken leg.
Okay.
Gram of IV paracetamol.
Yep.
He's on his second bottle of Entinox, but he's in absolute
Agony. Okay.
You know, we can't even get the splint on him. That's why we've asked for a little bit more help.
No problem.
The pain relief given to Cameron by the ambulance crew isn't strong enough. But Fay's special training means she can administer more powerful drugs only carried by the critical care teams.
I'm just going to take your t-shirt off. I know it's absolutely freezing, mate, but you're not bothered. I am.
Before using it, Fay checks Cameron for any other serious injuries.
Any pain in your neck?
No, nothing.
No, okay. Nothing in your throat here?
no, nothing.
Okay. Any pain in your tummy?
No, nothing.
No, okay. Any pain in your shoulders up here?
No, nothing.
No. Wiggle your right hand for me. Brilliant. Wiggle your left hand for me. Well done. Can you clench your bottom cheeks together? That'll do. Okay. It's all this pain in your leg. Okay.
Cameron has broken his right thigh bone, the largest bone in the body.
Which leg am I touching, left or right? Good man.
There is also the risk Cameron could have broken his pelvis or damaged his spine, which could cause paralysis.
No pain as I'm touching down your back? No, okay. Okay, wiggle your toes. Good man.
Thankfully, Cameron's spine doesn't appear to have been damaged. Fay can now turn her attention to his broken leg.
All right, Cameron, I'm sorry. It's not helping the fact that it's so bloody cold. Could you plug that into your ETC?
my leg's really gone out. Stop putting
We're gonna help you now, Cameron. Sorry, my friend.
Fay wants to get Cameron to hospital, but he's in too much pain to be moved.
At the moment, the reason why it's so uncomfortable is because you have broken your leg. Is the two bones are scratching against each other. Okay. As soon as it's in line, you will create your own pain relief because it's back where it should be. All right. It's all set up, isn't it? So if we give him a little shot of ketamine and.
Straightening his leg is an excruciating procedure, so Fay prepares to give Cameron a powerful painkiller called ketamine.
So Cameron, I'm just going to give you this drug, okay? It will make you feel a little bit sleepy, but it's just so that we can pull. I'm only going to give you a touch so we can pull that leg. The moment we pull it, it'll actually feel. No, trust us. Trust us. 1, 2, 5.
It's essential Fay straightens Cameron's leg as soon as possible. While it's out of alignment, it could be causing internal bleeding with the risk of life-threatening blood clots.
Soon gonna be over, mate. Soon gonna be over.
Critical care paramedic Stephen Mitch Mitchell is starting the Saturday shift by making sure his kit is ready for whatever the day brings.
This doesn't look tidy enough for my liking. Everything keeps you on your toes, and you almost have to be a certain character type to do this type of job. I think the weather will keep people indoors today, but we'll have to see.
Ambulance service, is the patient breathing?
I think no breathing. I touched him, but no reaction.
Okay, is he breathing?
I don't think so.
We need to start CPR.
Yeah.
Okay, put one hand in the centre of his chest and lock your fingers together. You're going to keep your arm straight, push down hard and fast. Don't be afraid to push too hard, okay? You're going to go push, 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 push.
Yep.
Say push out loud every time. Push, 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 push. 1, 2, 3. 1, 2, 3. Keep pushing. Don't stop until they tell you to. Can you see the ambulance anywhere?
Yeah.
The collapsed man who's not breathing is a code red emergency. Local ambulance crews are on scene, and to help with advanced life-saving treatment, Mitch is also on his way.
So it's reports of a 40-year-old male who's had a cardiac arrest, so hopefully we can help out where we can.
With cardiac arrests, time is crucial. When the heart stops beating, no blood is pumped around the body, starving vital organs of oxygen. Every minute without CPR, the chances of survival drops by 10%.
Oh, there, guys, you all right? It's Mitch.
Captain Paramedic Fay, boys.
That's why I was doing CPR, but he said it didn't look that effective, but he was doing his best he could.
The man was found 17 minutes ago, collapsed and in cardiac arrest.
A little bit faster, Chief. Keep your elbows straight. That's it.
He's had 3 shots, and he's had 1 of them.
OK, what we'll do is we'll go on the next rhythm check at 13 minutes past.
The ambulance crew found the man's heart in VF, or ventricular fibrillation, which means it's quivering rather than beating. Despite using the defibrillator 3 times and administering adrenaline, it has not regained a normal rhythm.
Everybody else stand clear for me. On 1, stand clear. So 3, 2, 1, back on the chest, guys. OK.
The man is only in his early 30s. Mitch and the crew are battling to save his life. Across the West Midlands, the critical care teams are on call 24/7 for all life-threatening emergencies.
BVM. Yeah, on Entrola's on, reading at 3.0. BP system.
You don't know what you're going to. That's part of the challenge, is you're dealing with all sorts of conditions, environments, as well as all sorts of issues with the patient. And you never quite know what you're going to get until you get there. And it's probably the reason that most of us sort of end up in this role.
Just gonna have a little look at your foot, okay?
Nice deep breath.
Well done.
Ambulance services, the patient breathing?
She's breathing, but she's not responding.
Okay. Does her breathing sound noisy? Is there any gurgling or wheezing sounds?
Yeah, if I get off soon. Are you okay?
Is she responding at all?
No, she's giggling.
Just try and roll her on her side, remove anything from under her head and just keep checking this breathing for me, okay?
Okay.
Is she diabetic at all?
No, she's got MS.
She's got MS, okay.
The woman who has multiple sclerosis is unresponsive and struggling to breathe.
It's a 60-year-old female MS patient. She's been found unresponsive this morning, vomiting and aspirating.
A local ambulance is already on scene and has reported the patient, in her 60s, is choking on her own vomit.
She is a little bit of a large lady, so they have requested an extra 2 ambulances to assist, and we've got your stuff going as well.
Roger, thank you.
It's a potentially life-threatening incident, so critical care paramedic Kerry Hemus is also en route.
We're not sure what the cause is at the moment, and the crew are having to give her oxygen and assisted ventilations. But I do carry a little bit of different kit with regards to ventilation, so maybe I could assist with that. So I'm kind of thinking that through in my head. She's apparently a larger lady, so it's not going to be as easy as just sort of popping her on a chair or a scoop and just getting her out of there.
Kerry arrives on scene. 3 ambulance crews are already there.
Hiya. Hello there. Hi all. Hello. Hello. That's fine. Yeah. Does this lady live alone?
She does, yeah.
And what level of care do you know?
Full time today. Okay. She's a little bit wheezy.
62-year-old Susan has multiple sclerosis, an incurable, sometimes debilitating disease affecting the central nervous system.
What was her last blood pressure? Okay.
Susan, open your eyes for me, flower.
The ambulance crew has cleared her airway of vomit and she has been given oxygen to assist her breathing.
Right. So what's her rest rate now?
20.
20, lovely. Bless her.
Susan, hello.
She's very warm, isn't she?
She's got fentanyl patch, which was removed.
Right.
She's had 800.
So she's had it every 3 to 5 minutes.
Okay.
Susan was wearing a slow-release fentanyl patch for pain relief for an existing condition. Worried she may have received too much of the strong painkiller, the paramedics have removed the patch and are giving her Narcan, a drug that reverses the effects of opioid overdose.
She's got a lot more responsive than she was.
But Susan's breathing is still laboured and she appears confused. Kerry and the crews need to decide how to get her out and into the ambulance.
Right, are we thinking parachute? Do you want to get her on the sheet on the bed? If we roll her, pop it on, so slide under as much as we can, then roll her towards this way, pull it out, and then we can lower her to the floor, and then we can all just do a bit of sliding.
The slide sheets emergency teams use to move patients in tight spaces can carry people weighing up to 62 stone. Kerry coordinates the operation to get Susan out and onto the ambulance.
So if we try and concertina it on this end.
Sorry, Susan, sweetheart. Bend your legs for us. That's it, sweetheart.
Fantastic. Well done.
Well done, darling.
To prevent her falling off, Susan's legs are placed in a large pocket at the bottom of the sheet.
Right then.
Susan is on the slide sheet, but getting her out and onto the ambulance is the team's next challenge.
You need to speak. Carry on speaking to us. Tell us what do you do? Where do you work? Just up the road. Doing what? Engineering. Okay.
Over in Dudley, critical care paramedic Fay Pollock is treating teenage motorcyclist Cameron following a collision with a car.
We've got everything at hand just in case we need to start helping him out with his breathing.
Cameron needs to be in hospital, but first Fay must realign his broken leg in order to ease his pain and to prevent a dangerous internal bleed.
We are all in position to give that a good pull. We're nearly ready, we're nearly ready.
Manual realignment is agonising, so Fay has given Cameron a strong painkiller and he is also taking gas and air.
Can you feel me touching you? Yeah?
The right one. Come on.
That's it, Cameron. That's at the pole. That's it, that's it.
Well done, you. Well done.
That's it, Cameron. It's done, mate. It's done.
Now the leg is straight, it needs to be kept in position.
That's it. Get ready with the pole. That's it. Yeah, pull the red now. Pull the red tab. Yeah, that's it.
Fay uses a traction frame to lock it in place.
That's it, that's it, that's it. Let's see how that is. Let's see his legs. Let's see his legs.
Well done.
Cameron, how is that feel? Is that feeling any better now?
Yeah, it feels better, yeah.
Okay, excellent. Well done, everyone. Cameron, what we're going to do is just going to roll you onto your poorly leg for just a second to get the stretcher under you. So it's only going to be for a few seconds.
Sorry, mate.
Fuck off.
Fine, we're under. Right, ready, set, roll.
That's better. That's it. That's it. It's done. It's done. It's done.
Have another suck on that, mate. Have another suck.
I know you feel absolutely rubbish at the moment, mate, but you're quite lucky that we're only dealing with your leg.
1, 2, quick.
Brilliant. We'll get you nice warmed up.
To avoid hypothermia, Cameron is wrapped in blankets and foil to keep in as much body heat as possible.
Perfect.
Looks like it's tense it all.
Now that we've straightened it up, all your muscles are all out of kilter, so it will start to spasm. 6-2, thank you.
Fay calls the trauma desk, who will inform the hospital to Cameron's arrival.
We're going to Russell's Hall, trauma tool positive stage 3, and our ETA now is probably about 5 minutes. We've alerted the hospital, so there'll be a couple of doctors waiting for us. Okay, good man. He was extremely lucky that he hasn't suffered more injuries. He could have bumped his head straight onto concrete and got himself a traumatic brain injury. I appreciate he's probably in a lot of discomfort at the moment with a broken leg. He really is perhaps the luckiest chap around today because it could have been far worse. We're here now, my sweet. All right.
Now as comfortable and stable as he can be, Fay can hand Cameron over to the waiting hospital doctors.
Just a few bumps, Cameron, okay?
Go ahead, Beck. Evening, I am here. I have drugs, so I'm just doing the checks, but you can use me if you need me, over.
It's Saturday night, and trauma doctor Matt Rowley and critical care paramedic Becky Chappell are beginning their shift.
We've had some really busy shifts together, but we've had some quieter shifts as well, so we'll see.
Years ago, everyone would say that Friday, Saturday nights are probably going to be your busiest nights of the week, but it can be a bit hit and miss. You can sometimes have busy weeknights, but historically, Friday, Saturday night will be busier. So I think as the night gets later on, we tend to see more things happening. Righto.
Ambulance services, the patient breathing?
Yes.
Are they conscious?
I don't think so. Well, my husband is falling down the stairs.
Okay. How old is he?
76.
We'll come with blue lights and sirens as fast as we can, okay?
A 76-year-old man unconscious after a stair fall is an immediate code red emergency, potentially requiring urgent critical care. So Becky and Dr. Matt are en route.
Worst case is if he has fallen top to bottom of the stairs, he could have a really significant brain injury, which has left him unconscious. If that's the case, we'll assess him when we get there, and potentially one of the things that we can do is to give him an anaesthetic and to put him into a medically induced coma.
In Britain, someone falls downstairs every 90 seconds, killing around 800 people a year.
Whether it's people that have slipped, whether they've had a medical event such as a heart attack or a stroke which has caused them to fall downstairs, whether they're intoxicated and fall downstairs, it definitely makes up a lot of our workload.
Becky and Dr. Matt arrived 16 minutes after their alert.
How you doing?
Hi,
You all
all
right?
right.
So, what we got?
Hello.
76-year-old Joe was on his way up to bed when he fell. His wife Sybil called 999.
Joe, can you stick your tongue out for me? Good man. Give my hand a squeeze. Joe, give my hand a squeeze for me.
Joe is barely responsive and his speech is slurred, which could indicate a brain trauma.
Do you know where you are at the moment? Where are you? Say again. Yeah.
To properly assess him, Matt and Becky need to get Joe onto the ambulance.
Right, OK.
Okay, you're just walking down it.
Joe, just relax for her. Just relax,
Okay.
darling. Have you got pain in your head?
We're going to get you in the ambulance and have a little look at you. Get you warmed up first, yeah?
Give both of your feet a wiggle for me.
It's a good sign. But Joe needs a hospital scan to fully assess if there has been any damage to his spine.
Good, well done. Let's have a little feel of your chest. You got any pain anywhere, Joe?
Joe has no obvious serious injuries, but he's confused and his breathing is laboured.
He's definitely struggling, isn't he, from a respiratory point of view?
Brain trauma remains a risk. Becky seeks clues from his wife.
Does he take any blood thinners?
I think he does.
If somebody's taking blood thinners, they're at an increased risk of bleeding. So if they have bumped their head, been unconscious, they've got an obvious head injury, they are at risk of having a significant bleed into their head.
All right, are you in pain, Joe?
I'm going to swap with you, so in 5 seconds, 4, 3, 2, 1. OK, jump out of the way, George. Nice one.
In a Wolverhampton churchyard, critical care paramedic Stephen Mitchell is leading the resuscitation of a man found collapsed in cardiac arrest 22 minutes ago.
That looks like VF. Georgia, can you charge the monitor? OK. Everybody else stand clear, please. OK, everyone clear? Yeah. 5, 4, 3, 2, 1. OK. Right.
The man has now had 8 shocks from a defibrillator, but his heart has not gone back into a normal rhythm.
I'm going to get the Lucas device out. Open up the Lucas device over there for me, please.
Despite being very unstable, Mitch makes the decision to move the man to hospital.
OK, so mate, do you want to sort of go the other side and feed that under his back for me?
To keep blood pumping on the journey, he decides to use a Lucas device. Only carried by the critical care team, it performs automatic chest compressions.
We're going to place that underneath him, so I need you to lift his shoulder up for me. Sit him slightly forward. So Georgia, can you support his head? And then we'll put that underneath his armpit. Slight lift. Go on, put it through, Rich. That's it. Go for it. Yeah, push it on. OK, it's about to start, OK.
Lucas device fitted, Mitch can now move the man to the ambulance.
Right, what we'll do, guys, we're going to lift either side, watch everybody's toes, just feed the trolley in. Would you mind grabbing the foot end of the stretcher? Rich and myself, we're lifting the stretcher on 3. 1, 2, 3. Dan, push. OK, push. Sit. George, get the patient on the truck for me, please. OK, you ready? OK, watch your back. OK, that's VF. Charge and shock that, yeah?
Everyone clear? Yeah. Shock in.
Before they move, Mitch gives the man another shock to try and get his heart back into a normal rhythm.
6-2.
6-2, go ahead, Mitch.
Mitch calls the critical care desk, who will update the nearest cardiac unit on the situation.
So, male, 30s to 40s. Currently, Lucas, he's had 9 shocks and he's in VF. He was found rather than witnessed. Received.
Yeah, thank you, Mitch.
Nice one, Rich. Just nice and steady.
9 minutes later, Mitch delivers the man to hospital, with the Lucas device still maintaining blood flow round his body.
Yeah, you're happy there? Oh, slowly, slow. Yeah, it's right. OK, got it. Oh. All right, cheers. Yeah. His heart was in a disorganised rhythm throughout, and it needs shocking all the time or special drugs, so we brought him here where we can sort of take that a little bit further. And unfortunately, he's quite cold today, and whether that's been a factor to what's happened, we don't know.
You grab that bit and then... OK. Everyone ready? Are we going onto the floor now? Happy? Just gently does it?
In Birmingham, critical care paramedic Kerry Hemus is leading the effort to get 62-year-old Susan onto the ambulance.
Ready, steady, move. I'm sorry, Susan. Everyone happy?
Yeah.
Lower. Okay. We can try and lift and slide at the same time. Is that all right? Right.
Susan, who has multiple sclerosis and is also overweight, is confused and having trouble breathing. Suspected of suffering from an accidental overdose of painkillers, she has been placed onto a slide sheet and taken off her bed. Kerry now needs to oversee getting her out of the house.
Ready, steady, slide. Is everyone happy? Ready, steady, slide. Perfect.
Sorry, Susan.
That's fine, darling, that's fine. Right, we've got a little bit of a lip here we're going to need to lift her over, so ready, steady, slide. Right, is everyone happy? OK, we'll just go... Yeah, well, we'll go up as far as we can, yeah? Everyone happy? Mind your back.
The most strenuous part of the procedure is lifting Susan onto the stretcher.
Right, ready, steady, lift. OK, just a bit, legs on first, that's fine, and then we'll readjust. Shall we stop a second, reposition? Yeah? When you're ready, yeah? Ready, steady, move. Beautiful. Right, let's get her in the warm and then we'll reassess. How are we doing, Susan? Okay.
Happy?
Yeah, happy.
Led by Kerry, but working as one, the paramedics start their transfer of Susan to hospital.
Yeah, slippery here as well. Oh, mind your foot. That's it.
Take you to hospital, Susan.
With Susan's breathing still laboured,
There's a wheeze on the chest if you want to let them know.
Kerry travels with her in case she needs critical care. At the hospital, Susan's symptoms will be investigated further.
Right, I'll take this in with me. Her conscious level has come up and she started to respond. Is what we call aspirated, and that some of that vomit has gone on to her lungs, which is why she's wheezy. And now it's over to the hospital to try and make her better and sort her out.
Trauma doctor Richard Fawcett
GI gels is what it says on the tag.
and critical care paramedic Pete Edwards are preparing for their shift.
It's payday weekend, Friday night. Could expect anything. I'd be surprised if we don't go to a stabbing tonight, maybe an RTC, potentially somebody falling down the stairs. That's the sort of typical things, but it could go manic. Expect the unexpected.
Ambulance service for patient breathing.
Yeah, but it's really an emergency. It's got stabbed, a massive wound, and it's breathing and I can't stop it. You can see his stomach.
Get a dry dressing or a clean cloth, fold it into a pad and press onto the wound. How old is he?
40.
Can you try and talk to me on the phone? Hello, sir. Where have you been stabbed?
In my belly.
Have you lost enough blood to fill a coffee mug?
Oh, there's blood everywhere.
A knife wound to the abdomen could be a Category 1 emergency. An ambulance is en route, and just as Pete predicted on payday Friday, so are he and Dr. Richard.
Got reports of a gentleman who's apparently been stabbed or slashed with a Stanley knife in a pub and has extricated himself home.
Now bleeding for over an hour, the volume of blood loss could become life-threatening. As Richard and Pete arrive at the house, our crew is asked to not film inside the property.
It's like a slash. No evidence of any major hemorrhage, and it looks like it's just in the fatty tissue.
The man's wound is superficial, and the local ambulance crew has stemmed the flow of blood loss.
We're going to just load him up and get him gone.
982 Whiskey Romeo over. They're going to take him to the QE. There's laceration to the torso.
The patient needs hospital treatment, but his injuries are not life-threatening. Richard and Pete leave him in the care of the ambulance crew. It's shaping up to be a typical Friday night for the critical care team as their second emergency comes through.
Service, how can I help? Hello, it's West Midlands Police. Can I have an ambulance, please? Yeah, what's the reason for us attending? We've got an RTC. One person's been ejected from the vehicle, possibly in the stolen car. He's been in pursuit. We'll be there as soon as we can.
It's a road traffic collision with the potential for catastrophic, life-threatening injuries.
The details at the moment are all very sketchy and very limited. We're only about 3 minutes away, so I'm sure we'll find out soon enough.
Pete and Dr. Richard are the first medical team to arrive.
It's clipped the van, hasn't it?
Look at that. Is it this?
Fucking hell, they've ricocheted all down the road.
Police had been trying to stop a suspected stolen car, but the pursuit ended after the driver lost control, smashing into numerous vehicles on a residential street. An officer briefs Pete and Richard on the casualties.
Is it just the one patient, is it?
Yeah, well, we've got one in our police car there who was a passenger, but he's ran off and been caught in a foot chase. So our main concern is this guy here. He's been ejected from the rear and he was struggling to get up to begin with. We've managed to keep him as sedate as possible. So he's got some visible cuts on his eyebrows.
Hi, mate.
Alright.
How you doing?
Fine.
All right, I'm Pete, one of the paramedics. Can I just have a quick feel of your wrist, mate? Yeah. Okay. Do you know what day it is?
Yeah.
What day is it?
Friday.
Let's just whip your top up, mate. Let's have a proper look at you.
The man is alert, ruling out a brain trauma, but Pete needs to assess him for other serious injuries.
You got no pins and needles or anything on you? All right.
When the ambulance crew arrives, Pete brings them up to speed as they prepare to take the man to hospital.
He's got facial injuries. The best thing to probably do is, if we just get the stretcher, we'll do all the observations and the checks in the vehicle. You say you haven't got any medical problems like asthma or diabetes? You've got a hole in your heart. So any breathing feel all right? All right.
A hole in the heart can weaken it, and the artery supplying blood to the lungs. Pete wants to get the man onto the ambulance to check if he has any internal injuries.
You can feel me touching that? Yeah. Give me a squeeze. And this one? Yeah, all right, okay.
Right, so let's sit him forward and have a quick gander at his back.
We're going to sit you forward so we can just have a look at your back a little bit and your chest, okay? We'll sit you forward, okay? If you come forward with me, that's it. I'll keep a hold of you.
In Stourbridge, 76-year-old Joe has fallen down the stairs at home.
There, we've got a bit of an abrasion there. Joe, is it hurting anywhere? I'm pushing here. Yes, whereabouts? Tell me when it hurts.
In your neck?
I mean, there's no crepitus, there's no instability, deformity or anything there. I think from a brain injury point of view, he seems okay. He's able to talk to us and he's alert. I think we're more concerned that he's got an underlying medical problem that's caused him to have a fall.
Just leave that on, Joe. That's helping your breathing.
His work of breathing is quite hard. His oxygen levels are low, so there's a concern that there's possibly an infection in his chest.
Despite being on oxygen, Joe is still struggling to breathe.
Shall I just go and speak to wife and see what it's been like in day with his breathing?
Yeah, okay.
All right, must just there if you want.
Any information Joe's wife has could help determine their course of action.
Has he been struggling with his breathing today? Has he been like breathing quite quickly and looking a bit out of breath?
Yes, I noticed it yesterday or the day before. He came downstairs and he couldn't get his breath. He was breathing, you know.
Right, OK, so he has been struggling today, but anyway, OK. So he has been struggling quite a bit today with his breathing, quite out of breath coming down the stairs and such. So I think this is probably how he's been.
A lung infection, like pneumonia, could quickly become life-threatening. Joe needs urgent hospital care.
Do you want us to travel with you, all of us, or?
Yeah, if you don't mind.
Yeah, that's fine.
In case Joe's condition worsens, Becky stays on the ambulance, ready to provide life-saving treatment.
So was he initially unconscious, completely unconscious?
He was conscious throughout with us. His wife says that she's been conscious throughout with him.
Joe arrives at hospital, where any internal injuries and his difficulty breathing can be investigated further.
What we're going to do, we're going to get a stretcher here.
Yeah.
We're going to get you onto it, all right?
Yeah.
In Wolverhampton, critical care paramedic Pete Edwards and trauma doctor Richard Fawcett are on scene at a road traffic accident involving a suspected stolen car.
Don't move your head. Have you got any pain in your neck or anything?
A passenger who was thrown through the car's back window and onto the road hasn't moved since they arrived.
Okay. Definitely no pain in your legs, no. Nothing? Sure, moving all right?
You can get up.
All right, OK.
Having found no evidence of serious injury, Pete decides it's safe for the man to stand up.
OK, nice and steady. Just sit forward, right? Just nice and steady. No pains?
No, nothing.
All right then, mate. Come and sit on here then, yeah. Pop yourself on there. Swing your legs up.
A bit further back. There we
It all seems to be facial injuries. You've been lucky, mate.
Incredibly, despite his ordeal, other than some cuts, the man appears unhurt.
He should have some major injuries, but actually, he's remarkably uninjured. Very lucky, extremely lucky. When you look up the street and see the damage to the cars, you'd expect some serious injuries, but yeah, nothing. Nothing major, at least, anyway, which is a good thing.
It's 5 hours into Richard and Pete's Friday night shift.
On to the next.
And their third emergency call is coming through.
Ambulance service, can I help you? Hi, Amber, can we request your attendance, please? Yeah, are they conscious and breathing? We've got a vehicle that's gone into a wall. I think there's a number of people in the vehicle, not just one. What's the vehicle hit, sorry? It's hit a wall. We're currently requesting fire as well, because it sounds like potentially they're stuck in the vehicle. They're trying to get the female out of the rear, and she's screaming in pain. The engine has come out of the vehicle, so it's going to be very high impact. I'd be surprised if there wasn't any injuries.
Sounds that there's maybe people trapped inside the car, so either they've sustained serious injuries and they can't actually get themselves out because they've got broken bones, etc., or the impact of the crash has caused the metalwork to crumple and physically trap the patient inside, or a combination of both.
It's another typical post-midnight road traffic accident, and all 3 emergency services have been called to the scene.
From both ends of High Street.
Firefighters are trying to free a trapped passenger. The operational manager briefs Richard.
Female still in the back. She's got apparently some neck pain. The driver apparently has walked off, so unknown where he is at present, and they're not being very au fait of who he is and where he is.
The car has come around a bend, veered off the road and hit a stone wall.
A heck of a whack, isn't it?
Yeah.
The high-impact crash demolished the front of the vehicle, dislodging its engine and throwing it clear. The driver has disappeared, and the woman left trapped inside has just been freed, so Richard can assess her. She's traumatized and in pain, but Richard's satisfied the woman has no life-threatening injuries. It's the second remarkably unscathed passenger involved in a major car crash that Richard and Pete have had on their Friday night shift.
Not really got any apparent obvious significant injuries. It's just complaining of some neck and back pain over.
Fortunately for this individual, they can leave her in the care of the ambulance crew, who will take her to the nearest hospital.
There's quite a lot of damage to the front of the car, but actually the crumple zones have absorbed all the energy, and the actual part of the car where the passengers were sitting is actually undamaged. So they've got away with it really, done really well. It's got a shoulder injury, but otherwise seems uninjured with what could have been. She's got off lightly, so we're not required. Ambulance crew more than capable and happy to deal with that.
As Pete predicted, it's been a busy payday night shift for the critical care team.
We've done the stabbing, 2 RTCs, which is a pretty regular weekend night.